The World Health Organization has highlighted a resurgence of dengue fever cases globally, raising global health concerns. Over 5 million cases and 5,000 deaths have been reported since the start of 2023. In Africa, the number of dengue infections rose ninefold in 2023 compared to 2019. Over 170,000 suspected cases, including more than 70,000 confirmed and probable cases, and 753 deaths have been reported in 15 countries. Burkina Faso has been the most affected by far, accounting for 85% of Africa's reported cases and 91% of recorded fatalities. The World Health Organization says limited capacity for early detection in most countries continues to heighten infection risks and cases. The UN agency has created a mapping for 47 countries based on the risk of dengue outbreaks. We're joined by Dr. Ching-Shia Zhong, Technical Officer, Global Neglected Tropical Diseases Program at the World Health Organization. He is based in Geneva, Switzerland. Thank you very much, Dr. Ching-Shia, for joining us. We have seen multiple country outbreak of dengue across the African continent. Why is this the case?
Hello, thank you for having me here. So first, allow me to say a few words at the global level. So dengue incidence has increased tremendously over the past 2 decades. In the whole world, we're talking about a 10-fold increase in reported cases worldwide from the year 2020 to 2019. So 2019 was especially a bad year for dengue, with reported cases spreading across 129 countries. There seemed to be a slight decrease of cases between the year 2020 to 2022, linked to the COVID-19 pandemic and lower reporting rate. But last year, 2023, we saw that dengue was back. We have again more than 5 million cases reported worldwide. So the outbreaks, back to your question, including those in African continent, are linked to a lot of factors. No need to mention climate change. We have the consequences of El Nino phenomena in 2023, and climate change leads to increasing temperatures and high rainfall, humidity, among others, in many regions, including African countries. And this facilitates the increase of vectors and changes of their distribution. That many African countries are seeing continuous rapid urbanization, a lot unplanned, which often favors the breeding of mosquitoes and the spread of dengue. That's why it's really important to reduce vector population and sustain it. Then we have now increased global travel following the COVID-19 pandemic. And the humanitarian and armed conflicts certainly exacerbate the situation, with more population displacement, disrupted health system, restricted access to healthcare services, and inadequate living environment, which again promotes the transmission of vector and also waterborne diseases.
Right.
Lastly, our population have weakened immunity, because of the relatively low transmission during the pandemic period. But as I said, just if you allow me, the detection of dengue cases was affected during the pandemic due to staff redeployment, especially in many African countries where resource was already scarce even pre-pandemic. So there was also decreased pursuit of healthcare services during the COVID-19. So the real situation during the past couple of years is sort of masked.
Okay, how severe is it in Africa, and which countries have been the most affected?
Right, so Africa is among the regions most affected by arboviruses or arthropod-borne viruses, including dengue, chikungunya, Zika, onyonyo yellow fever, and among some others. In 2023, over 170,000 dengue cases have been reported in the region. It's a 9-fold increase from 2019. Remember, I just mentioned 2019 was a year when we've seen an unprecedented dengue peak globally. But in African region, although just a handful of countries are marked endemic, we had evidence of circulation in local population or return travelers in more than 30 countries in Africa. What is also worrisome is the further spread to areas previously free of dengue. For example, dengue has affected Chad and Mali due to movement of displaced populations from Sudan. Then the most affected country in the African region in 2023 is Burkina Faso, followed by Ethiopia, Mali, and Cote d'Ivoire. Burkina Faso actually accounts for more than 80% of cases, 90% of deaths of the region, as mentioned before. But the country has been making great effort to control the situation, and the overall trend has been declining since November. The impact of dengue is higher now than some previous years because we've seen co-circulation of multiple dengue serotypes in some African countries, which may result in an increased number of severe dengue and deaths following secondary infection due to antibody-dependent enhancement. Sorry if this sounds a bit complicated, but basically a person with antibody towards one dengue serotype might experience more severe dengue if infected by another dengue serotype. For example, during the outbreaks in Burkina Faso last year, 2023, 3 dengue serotypes were identified, 1, 2, and 3, and this makes the situation more complicated. Again, in the end, I want to add that the burden of dengue in Africa is not well understood due to first similarity of common non-specific clinical symptoms of the disease with malaria and other tropical febrile illnesses. Second, there is limited laboratory capacity for timely detection and confirmation of dengue, which is crucial for detecting and reporting cases and preventing its spread. And lastly, inadequate surveillance and limited case reporting, especially for dengue. For example, some countries like Senegal and Mali experienced simultaneous outbreaks of dengue, Zika, and chikungunya. So we're facing the issue of underreporting of cases due to limited capacity for early detection and confirmatory diagnostics.
All right, and just very briefly as we wrap up, what is the WHO and partners doing to help countries in Africa fight this outbreak, and especially in vulnerable countries that you mentioned, such as Burkina Faso and Mali?
Right, so globally, WHO is providing technical support for dengue diagnosis, case management, vector surveillance and control, and risk communication and community engagement through guidelines. We help countries with risk and capacity assessment, support them to develop their own strategies and action plans. We conduct capacity building, and we also support in medical and vector control supplies. And a couple of years ago in WHO, we launched a global arbovirus initiative to build a global coalition of countries and strategic partners to tackle the increased risk of arbovirus transmission. The aim is really to strengthen an integrated, multi-sectoral and coordinated approach as the arboviral diseases, the determinants of these diseases, such as dengue, go really beyond each one disease and beyond the health sector, rather concerning a long list of non-health sectors. And with the limited resources, especially in those countries in Africa, we need to work together in a coordinated manner. So after launching this global arbovirus initiative, we're working now with our regional colleagues and country colleagues to facilitate the implementation of the initiative at regional and country level. Then we're also continuing our research and evaluation of new vector control tools. Hopefully, a couple of them can be deployed soon in those affected countries. We're also improving our dengue data collection system to encourage more systematic data collection and reporting in countries, especially in Africa region where this is currently rather inadequate. And at headquarters or at regional and country level, we also established or reactivated our incident management support teams to coordinate response. Then, as mentioned recently, our colleagues in WHO's regional office in Africa also built a dynamic dengue risk mapping system for the region, categorizing countries into tiers to better guide interventions and response actions based on the risk of dengue outbreaks.